This is CGTN, China Global Television Network.
COVID-19 cases in South Africa climbed to 709 overnight, with the country set to go into lockdown for 21 days. DRC declares state of emergency and shuts borders globally. The WHO says the United States could become the new epicenter of the pandemic. And more good news from China's Hubei province ends a total lockdown, with some public transport coming back this week. Hello and welcome to Africa Live here on CGTN. I'm Mahia Mutua in Nairobi. Also coming up, South Africa to finalize a stimulus package as the COVID-19 pandemic threatens Africa's most industrialized economy. And in sports, the World Under-20 Athletics Championship set for Nairobi from the 7th to the 12th of July moved to a later date. Now, in Africa, over 2,000 cases of COVID-19 have been reported in 43 countries. Let's now take a look at the latest numbers by region. Northern Africa has the highest number of confirmed cases. Infections in Egypt have jumped to 402 after 36 new infections were reported. 5 more people have died in the country, including 4 Egyptians and an Indian citizen. Algeria comes in second with 34 new cases, bringing the total to 264. Authorities say that so far 17 people have died from the disease. Morocco has 170 cases, reporting 4 deaths and 5 recovered patients. A 1-month state of a medical emergency has been declared until the 20th of April. In Western Africa, Burkina Faso has the highest number of cases in the region with 114. 7 new cases of infection have been detected across Senegal, bringing the total number to 86 cases. Senegalese President Macky Sall declared a state of emergency along with a curfew from 8 p.m. to 6 a.m. Ghana has also recorded a second death from coronavirus with 1 new infection, bringing the total count in the country to 53. In Eastern Africa, Kenya's cases have jumped to 25 after 9 new cases were detected on Tuesday. Out of the 9, 7 are Kenyans and 2 are foreigners. Rwanda maintains the highest number of cases in the region with 40 infections. In Central Africa, Cameroon numbers are up to 72 from a previous count of 56. The Democratic Republic of Congo also saw a rise with 45 now confirmed. And the number of confirmed coronavirus cases in South Africa has spiked to 709, with 155 new infections confirmed. The country is the worst affected in Africa so far. Meanwhile, as the number of cases in South Africa continue to rise, the country's health minister, Zweli Mkhize, insists that a shutdown will slow down the spread of the virus. The country's army has been deployed in various major cities to assist the government in enforcing the 21-day national shutdown, which starts on Thursday. Right now, for more on this, we are now joined by CGTN's Angelo Coppola, who joins us live from Johannesburg. Angelo, cases of the coronavirus are now up by 155. Can you tell us more on this and what has led to this latest surge in numbers?
Well, look, the bottom line here is that the jump was, in fact, 300 over 2 days. So it was a spike of 150 odd today and another spike of 150 on the day before yesterday. The biggest increase was in Gauteng, then there was the Western Cape, KwaZulu-Natal and the Free State. In fact, the concentration in Mangaung in the Free State, according to the Minister of Health, is a concern. And that's after 5 foreigners attended a church service there some 2 weeks ago, and they've all tested positive since then. So what's happened now is that the Red Cross has stepped in. It's trying to help track and trace those congregants that have then since dispersed to their different places of where they live. So it is a big concern, and he went so far, that's the health minister, as to describe Mangaung as an emerging epicenter, and those are dangerous words. There's also clusters of COVID-19 in Sant in Johannesburg, Ekurhuleni, Tshwane in Gauteng as well as in Cape Town. The surge can be linked to more testing and reporting by private labs, I'm told. The NICD then, of course, verifies those results. So those numbers are coming out thick and fast at the moment. So the surge could be linked to statistical data that's being released right now, Richard.
Now, of course, the cost of testing there does remain a key issue of concern, not just for South Africa, but for the continent as a whole. Are any measures currently being undertaken to make the testing that bit more affordable?
Well, look, there's no news on the actual cost of testing. That's besides the confirmation from the private medical insurance companies here that they will not pay for tests if those tests come back negative, and that's for the test and for any equipment used, obviously implying that they will pay for positive test results. Of course, the majority of the population in the country can't afford medical insurance, so it's a moot point. For those using the public health system, in fact, it's a little bit more complicated than simply turning up at a hospital. Patients have to go through the public health or hospital. They sit down there. They go through a vigorous questionnaire that has to be completed with a medical professional in play. And they have to also prove, one, that they've been in direct contact with somebody who has tested positive or is a suspect for carrying the virus, and two, that they are actually carrying the symptoms. So then the test becomes free. The anxiety is actually about whether the system can cope with the expected load of people who might need to be hospitalized. In total, we understand there are around 3,000 critical care beds in South Africa and around 1,000 to 1,500 ICU beds. And that's where the anxiety is resting right now, Richard.
And Angelo, just tell us more about the lockdown that's due to start tomorrow. Does that have something to do with where you are right now?
Well, look, that lockdown starts at midnight on Thursday night, so Friday morning, in effect, is when the lockdown starts. It's national. It's expected to last 21 days. We understand that it can, of course, be extended if the authorities think that the outbreak is not under control. Everyone is expected to stay indoors, except, of course, for those essential and critical services. We're being told that people are allowed to go shopping for essentials such as medical needs or medicines and food, or those seeking healthcare or collecting social grants, more importantly. It's the essential workers in the healthcare sector, the emergency services, police, the army, security staff, are the ones that are allowed to move around quite freely, as are those involved in the production and distribution of vital supplies like food and pharmaceuticals. They're exempted. Like I said, the issue here is around the SANDF and how it's going to help the South African police services do their job. It's unclear, of course, how people flouting any of the rules that have been put in play will be treated, whether they'll be jail time, whether they'll be arrested, whether they'll be sent home with a warning. But in the meantime, the country gets ready for an unprecedented change in the way we do and live our lives. Richard?
All right, Angelo, thank you very much for that. Do stay safe. Angelo Coppola joining us live there from Johannesburg in South Africa. Moving on now, South Sudan's government has received a donation from billionaire Jack Ma's Alibaba Foundation meant to fight the spread of the coronavirus. The donation comprises of face masks, testing kits, protective gear and suits for medical personnel. South Sudan still has no reported case of the coronavirus in the country. CGTN's Patrick Oyet now reports.
South Sudan's government says the donation is the first it has received from a company towards the fight to prevent the spread of coronavirus. It follows a donation of $100,000 to the World Health Organization from China to try and enhance preparedness of South Sudan to prevent the spread of the virus. South Sudan's government says it is taking steps to prevent the spread of the COVID-19. Juba has suspended gathering of more than 10 people. Schools are closed and all international flights are suspended. The Chinese embassy in South Sudan says the donation by the Jack Ma and Alibaba foundations will help South Sudan further strengthen its preparedness to prevent the spread of the virus.
Now we are very happy to be able to step up our efforts in supporting other countries fighting the deadly virus.
Beijing is asking more Chinese companies to donate to help fight COVID-19. South Sudan has set up a task force headed by President Salva Kiir to fight the spread of coronavirus. The country's Ministry of Health says it needs $5 million to prepare. The government is requesting more support from the international community. Patrick Oyet, CGTN, Juba, South Sudan.
Now, with one of the weakest health systems in the world, Somalia remains vulnerable to being hit by the coronavirus pandemic. But some medical students in the Horn of Africa nation have begun an awareness campaign to educate the community on how to limit the spread of the virus. CGTN's Abdulaziz Bilo has more now from Mogadishu.
Novel coronavirus 2019.
These medical students are receiving basic training on tackling the COVID-19 pandemic. With one positive case confirmed in the country, public health students from Salam University plan to increase awareness on ways to contain the spread of the virus. The lessons focus on practical ways to curb COVID-19 and awareness of basic hygiene.
Basic hygiene is the most important thing. We have two ways to do that: soap and water, antiseptic, and use of hand sanitizers and alcohol gels that kills all microorganisms and germs on our hands. At all times, we should keep away from infected persons, wash our hands regularly, and maintain less physical contact as part of social distancing.
Like most countries across the globe, Somalia has implemented strong measures to contain the virus. But with a weak health system and lack of protective equipment, medical experts say any outbreak in Somalia could be worse than in other countries.
You have been trained to save lives, prevent lives from critical conditions. We are all concerned about the effects of this virus, which can escalate any time. We have a responsibility on our part. It's not just a government responsibility. If this virus starts spreading, containing it will be a great challenge. Prevention is the best cure for now.
The government says a quarantine facility is ready in case of an outbreak. It has also set aside more funds for emergency health programs. A 2-week ban on international travel is also in place, with schools and universities across the country closed to prevent any potential spread of COVID-19. The country lacks testing kits for COVID-19. Any suspected cases are sent abroad for analysis. But the World Health Organization says it's planning on establishing a diagnostic lab here in Mogadishu to help detect any positive cases. For now, it's medical students and private health practitioners who are leading the way in containing the pandemic. These groups will be sent to displacement camps and across the city to increase public awareness on prevention as the first line of defense against contracting the virus. Abdulaziz Bilo, CGTN, Mogadishu, Somalia.
Meanwhile, in the Democratic Republic of Congo, the government has declared a state of emergency and ordered the isolation of the capital city from the rest of the country to prevent the spread of the coronavirus. The declaration was made by President Felix Tshisekedi on Tuesday following the rise in the number of infected patients to 45. CGTN's Chris Ochamringa has more.
The DRC president announced a ban on domestic flights to and from the capital Kinshasa to limit the spread of the coronavirus. The move comes a day after 2 people suspected to have the disease arrived in the DRC's second largest city of Lubumbashi in the southeast. Health experts say tests from the 2 people came back negative. The outbreak is currently confined in the capital Kinshasa.
The fight against COVID-19 cannot be won without the involvement of the community. We all need to play our role in preventing the spread of the disease in order to achieve victory.
Kinshasa is one of Africa's most populous cities with an estimated population of 12 million people. The outbreak of the disease has raised concerns about its spread to other provinces. Last week, the government suspended flights from countries with cases of the virus and banned large gatherings. The DRC has joined other countries that have imposed curfews and travel restrictions on their populations to control the spread of the disease. Chris Ochamringa, CGTN, Kinshasa, Democratic Republic of Congo.
Well, let's look at the global numbers now. More than 400,000 people have been infected in over 170 countries and regions. Europe and the United States have seen their cases surge. Italy has the highest death toll in the world with more than 6,800. Nearly 70,000 people have been infected. Spain is the second hardest hit in Europe with over 42,000 infections. The United States has reported more than 11,000 new cases, bringing the total to over 55,000. Iran, meanwhile, has reported over 1,900 deaths. On the Chinese mainland, no new domestic cases were reported, but 49 imported cases were confirmed. In Hubei province, where the outbreak began, nearly 500 patients were discharged from the hospital on Tuesday. Nearly 90% of patients in China have since recovered. Now, Chinese President Xi Jinping will take part in a video summit with a group of 20 leaders. They are expected to discuss ways to respond to the pandemic. The conference on Thursday will be hosted by Saudi Arabia, which currently holds the forum's presidency. The aim is to develop a global action plan in response to the pandemic and its human and economic implications. Now, after a 2-month suspension, China's Hubei province is resuming some of the public transport there. Inbound and outbound trains resume today, except those in the provincial capital Wuhan, where the outbreak began. Trains going to Wuhan will resume on Saturday, while outbound services will be available beginning on April the 8th. Meanwhile, some bus and subway lines are resuming operations between today and Saturday. Passengers will have to show a health QR code and wear masks.
From the midnight of March 25th, except Wuhan, the other provinces start to restore its transportation and reopen to the other places. And also for the people should with a health code or green code for them to move. And for Hubei province will also start to resume its transportation from April 8th. And we will also conduct a stringent rules. And of course, this should be conducted in a gradual manner. And we will also do the checking works at different stations and checkpoints. The March 27th, and we will finish all the works in the checking points.
Moving on to the United States now, the White House says it has reached a deal with lawmakers over a nearly $2 trillion economic stimulus package. The bipartisan compromise was struck after days of negotiations between senators and administration officials. It is the largest economic aid measure ever passed in the United States. The text of the bill is yet to be finalized. It is expected to send direct payments to Americans and send money to help states and businesses hit by the pandemic. Now, the World Health Organization says the United States could become the new epicenter of the pandemic. The country has more than 55,000 confirmed cases, and around half are in the state of New York alone. Despite the crisis, President Donald Trump wants the country to open up from restrictive measures in just a few weeks. Nathan King reports.
New York is once again ground zero, now racing against time to control a pandemic. The state's COVID-19 cases are doubling every 3 days, more hospital beds are needed, and vital ventilators to keep the sickest breathing are not being sent fast enough by the federal government.
You want a pat on the back for sending 400 ventilators? What are we going to do with 400 ventilators when we need 30,000 ventilators? You're missing the magnitude of the problem, and the problem is defined by the magnitude.
The White House says they are sending more. 2,000 ventilators Tuesday, 2,000 Wednesday. That's still not going to be enough, says the New York governor. He says thousands will die unless the federal government steps up, and soon. Meanwhile, the US president held a televised town hall meeting at the White House with Fox News, his preferred US network. His message could not have been more different. He talked of reopening the US economy in less than 3 weeks' time and compared COVID-19 fatalities to the seasonal flu and car crashes.
Our country is not supposed to be, it's not built to shut down. Our people are full of vim and vigor and energy. They don't want to be locked into a house or an apartment or some space. It's not for our country. We're not built that way.
The US president's views differ sharply from the medical advice he's been getting, and also governors around the country and even senior members of his own party. His natural optimism may have worked in more normal times, but when it comes to tackling the coronavirus, it could have severe consequences. Nathan King, CGTN at the White House.
You're watching Africa Live here on CGTN. It's time for us to take a short break. Here's what's coming up when we return. In our series on the COVID-19 pandemic, we take a look at ongoing awareness campaign initiatives by various African governments.
How will your world change today? What happens here? What happens there? Or what you make happen for yourself? If it matters to you, it matters to us too. Your stories are the stories that need to be told. Africa Live. Find your voice.
Now, on to our ongoing series on the COVID-19 pandemic on the African continent and beyond. Today, Lindy Mtongana takes us through the steps and efforts that African governments are employing in creating awareness on the outbreak. It is a battle to win the hearts and minds of the African people, yet it comes with its own challenges that are unique to each nation.
Well, yes, indeed. And when it comes to highly infectious diseases, information regarding how to avoid exposure becomes critical, and this really begins at a personal level. For instance, I have here with me a bottle of hand sanitizer. What's important about hand sanitizer is that the alcohol level must be above 60% for it to provide you with adequate protection. Now, all you do is pour a small amount into the palm of your hand and rub between your hands very thoroughly, and of course between the fingers too. Do not forget that. And this is what gives you protection from viruses and bacteria. What I also have with me here is a face mask. Now, this covers your nose and your mouth, and it certainly protects you from others around you, but it's also very, very useful if you are feeling even just the tiniest bit unwell. It will protect others from you. So, in today's series, we take a look into ways of protecting yourself and reducing your risk of contracting COVID-19. So CGTN conducted a survey on its digital platforms to determine the state of Africa's awareness on COVID-19.
The COVID-19 pandemic has firmly sunk its teeth in Africa. While the number of cases here remains relatively low in comparison to the rest of the world, information remains an invaluable resource. So just how informed is the African audience? CGTN Africa conducted an online survey to gauge just how aware our audience is of what's at stake. So we used two of the most frequently used social media platforms on CGTN, and that is Facebook and Twitter. On both these platforms, we posted 4 questions for 24 hours. The first question was, do you know the symptoms of COVID-19 and how you can protect yourself? 70.8% said yes, they do, while 29.2% said no, they do not. The second question was, do you feel well informed about how COVID-19 is transmitted? To this, 56.9% of our viewers say yes, they do, while 43.1% say they do not have this knowledge. The third question was on the awareness of the outbreak. 84.7% of our viewers are aware that there's a pandemic, while 15.3% of our viewers say they are not aware. The last question, if there was an outbreak of a serious disease like COVID-19 in your locality, would you feel safe? 31.5% say yes, they would feel safe, while a whopping 68.5% say they would not. Allow me to delve deeper into these poll results. Dr. Samrat Shah, who is the Medical Director and Consultant Physician at Medihill Hospital, Nairobi, joins me via Skype today to analyze these results. Thank you for your time, Dr. Shah. Now, let's dive right in. On whether or not people are aware of the current COVID-19 outbreak, we have Sheikh Utako saying, what I know about COVID-19 is that the world should stand together to fight this virus. We also have Yehuala Shet Ayele from Ethiopia, who says, yes, I regularly follow WHO reports about COVID-19, and that they have some doubts as to whether some people in Africa have better resistance or immunity than others. What do you make of these comments? Are people more immune? Do some people have resistance? Is this fact or fiction?
As a younger generation, you may have a lighter symptoms or mild symptoms and you may completely get cured from it. But what about those people who are going to get exposed because of these younger generations? See, those people who are having HIV, chronic kidney diseases, people who are having age more than 65, cancers, if they get exposed from these people who are younger generation, they are definitely going to have severe form of disease. So I think younger generation should be more cautious about being sensitive about this matter so that they don't give it to the older generations and does not cause a high mortality rate in the country. That is one thing. Second thing, having issues of resistance in African genetics, that's not true because I just feel that it is less technical awareness available, less lack of knowledge that is causing us to have less number of cases detected. It cannot happen that COVID-19 is there across the globe and it is not affecting Africa. We are just detecting less number of cases compared to that of other parts of the world because of lack of technology to test. But it does not leave any race or sex or any kind of genetics for that matter.
Thank you. Now, considering Africa was one of the places that at least had a little time to prepare as we were one of the last hit, is it shocking that 31.5% of our viewers say they would feel safe, while a whopping 68.5% say they would not feel safe if an outbreak happened in their localities? Are we using the small time advantage we had properly?
See, it's very true that people will feel unsafe because we don't have facilities as such if we have that pandemic coming out in the country. You see, just imagine the state like China had 60,000 cases and all of them were able to be isolated. But do we have such kind of facilities? We don't have. And that's the reason why the fear is building up among the people and people feel that they're not safe. It's actually not wrong to feel unsafe, but I think government has taken good measures to control the spread of the disease. I think things should be better in another few weeks of time.
Right. Dr. Samrat Shah there from Medihill Hospital, Nairobi. Thank you so much for your time, Dr. Shah. That was very, very informative.
So according to that survey, Africans in general are still somewhat skeptical about the coronavirus, especially when it comes to public awareness and the continent's capacity to handle an outbreak. However, the majority are now tackling the battle head-on by adhering to the precautionary measures. President Cyril Ramaphosa has declared a national state of disaster in South Africa in an effort to reduce the severity of the coronavirus outbreak. Ordinary citizens have been urged to change their behavior as a matter of urgency. Before government's decision to close all learning institutions in an effort to stem the tide of infections, CGTN's René Delcalm followed a 12-year-old student and discovered how the outbreak is affecting school kids.
And our top story this hour, a South African who tested positive for the coronavirus has been discharged from hospital.
On the streets of Bokmakiri near Cape Town, a poor, crime-ridden community is trying hard to adapt to the new reality of living with the new, unknown coronavirus. Like most families in South Africa and around the world, the threat of COVID-19 has forced the Peterson family to adjust their behavior in their daily lives. 12-year-old Angelique Peterson is an ordinary kid obsessed with social media. Now she has to deal with the fear and uncertainty surrounding the novel coronavirus.
I actually feel scared about the coronavirus because when it gets to you, it first starts as sickness, and then if you go to hospital, they haven't yet got a cure for it.
With limited resources, Angelique's close-knit family, school and community are all doing their best to try and keep the dreaded COVID-19 from their door.
I don't know what can happen. Yeah, I understand, and we know nothing about the virus because they didn't. We hear bits and bits what the Minister of Health is saying, but what I heard over the TV is like the people is very cautious now.
We need to be more extra cautious about what we're doing, our surroundings, who we're touching, who we interact with, washing our hands more than ever.
And in this household, the Petersons are determined to do their bit to slow down the spread of COVID-19 with good old-fashioned soap and water.
First, we take the soap, make your hands wet. At the moment, we're using soap and then dishwasher for our hands because that's the normal thing that we do have. Sometimes we do use hand sanitizer for the household at the moment. There we go. Put your hands full of soap.
And the all-important hand-washing protocol to guard against the virus is certainly a message which is reinforced at Angelique's school.
So there are 5 steps to washing your hands properly.
As a mother of not only my daughter, but also a mother of 300 and odd learners of the school, it is a very, very scary thought that it is now on the African continent, but not only on the African continent, it is now in South Africa.
What's the most important thing to do?
So I need to know that the teachers at this school are doing their jobs to get it out into the community, but myself also at home. And so that I have to practice all of these. I have to wash my hands. I have to let the children see that I'm doing all of these things.
And as scientists race towards developing a coronavirus vaccine, this young schoolgirl at the southern tip of Africa says if they don't succeed, she hopes to continue the fight by becoming a doctor in the future.
If they don't find a cure for it, in some day later in my older days, I will study for a doctor and I'll find a cure for the coronavirus.
As the experts say, slowing down the transmission of the highly contagious coronavirus is literally in our hands. What must we do? I later followed up with the family after the school closures. Lolita, when we spoke last time, you were very concerned about the kids, the family, contracting the virus. What are your thoughts now that the schools have shut down?
I'm so glad that I'm so relaxed now that the children is at home now, and also that they're safe and that they're not going to be exposed about the COVID virus, and also then I know because what happens is now it's getting more, the virus getting crazy now. There's more and more people having cases now that we hear that people's been affected.
So one of the buzzwords in South Africa right now is social distancing. Have you started practicing that in your home?
Outside the house, we also do practice that of the children not going out. And even the children are so bored. They're just sitting at home because they wanted to visit. Since that they've got school holidays, they wanted to visit their aunts and uncles, and I prevented them to go there because of for them not to be affected or being affecting other children. Yes, we do practice also washing our hands several times a day, and yeah, that's what we continue doing.
And coming from a low-income household, how are you managing to cope financially?
The COVID-19, it's a bit scary. I'm very scared for the near future because of being unemployed. There's no income in the house, of keeping the children so long at home for holidays. It's the basic stuff that we need, bread, milk, and all the stuff, of which is, I don't know how I'm going to make it.
Thank you, and best wishes to you and your family.
Now, from postponing large-scale events to issuing travel bans, Uganda is taking wide-ranging measures to prevent cases of COVID-19 in the country.
You have to wash your hands very, very well.
Keeping safe, these young people are disinfecting themselves from COVID-19.
When we heard about coronavirus, that it was spreading at a very fast speed, we decided that we will sensitize our learners, and we had 2 campaigns of sensitization, and we were talking about coronavirus and the different countries where it was already spreading very fast and how they could avoid or prevent themselves from getting the virus.
But the threat is more than ever before. It has forced these and other schools to close their gates. On 11th March 2020, we found students here learning how to protect themselves from contracting coronavirus. 9 days later, the government took drastic action to close all schools indefinitely as a safety precaution. Now, with the coronavirus in the country, it is hoped that lessons learned here are being applied at home. Parents are now sanitizing their homes, but the country has registered 9 cases in less than a week. Authorities blame this on travelers who breached the set guidelines, saying most passengers arriving from Dubai did not self-quarantine as advised by local authorities when they arrived in Uganda.
We have a record of all the passengers who traveled from Dubai. We have the manifest that we have retrieved, and for those under quarantine, we also have their passports. And so we are requesting, please call the health desk wherever you are so that we can access you and have you checked.
The government has now stopped flights into the country and sealed all borders. They have also banned all public gatherings for a month. It's hoped that with these measures in place, they will stop the spread of the virus in the country. Hilara Isiga, CGTN, Kampala.
Public sensitization has become a priority for most African countries, and people are now better informed on ways to avoid cross-infection. A good indication of the strides achieved in the battle against the virus. Back to you in studio.
Well, thank you, Lindy. Join us tomorrow for the next part in this series as we take a look at intervention measures being implemented by African governments in curbing the spread of the coronavirus. Well, coming up in business. South Africa to finalize a stimulus package as the COVID-19 pandemic threatens Africa's most industrialized economy. And we'll explore how businesses in Uganda are changing their logistics chains as this pandemic forces people to stay at home.
Africa is the nexus of enterprise, and global business will tell you why it matters.
From the mega investment projects to multi-billion-dollar mergers and acquisitions.
Africa today collects, just in terms of revenues from taxes alone, $545 billion a year. If you take 10% of that and you devote it to the energy sector, problem solved.
All this on Global Business, weekdays at this time on CGTN.
Now in business, South Africa's economic output shrunk in the second half of 2019, and now with the COVID-19 pandemic in place, some are forecasting a contraction of between 1.8 to 7% in 2020. The country's president has announced a 21-day lockdown from the 26th of March, but a fiscal support package for businesses is still being worked on. With the details, here is CGTN's Angelo Coppola.
The government's hands are tied. It doesn't have many options other than adjusting interest rates.
What's needed is not just sort of a modest stimulus, interest rate adjustment, and so far that's what's been going on. Is the interest rate adjustments have actually been relatively modest, and the fiscal stimulus has been very, very muted. Now, South Africa doesn't have a lot of wiggle room when it comes to fiscal stimulus, for the simple reason that all of our dry powder is now wet. We spent the money.
Business leaders say attention needs to be focused on small and medium enterprises.
Those people need to retain critical human capital for the recovery, yet there's no income for them. So we think that government must come with significant relief for SMME sector, which they can tap into for working capital.
Economists are telling government that they have to be more bold.
The extent of the stimulus that is needed is a 2+% of GDP, which would mean South Africa needs to throw into the economy at least 100 billion in stimulus. And that's leaving aside the interest rate moves of last week. So, what we've seen so far has been little more than, really fiddling around the fringes in terms of policy proposals.
The instrument that government can use at the level of the Reserve Bank, at a monetary level, is interest rates. The Reserve Bank went on a limb and cut interest rates by 100 basis points, 1%.
That's aggressive for our Reserve Bank. Probably needs to do more than that.
Not everyone agrees that rate cuts will entirely solve the problem.
Interest rates have been cut by 1%. Now, that doesn't really change the cash flow of many businesses, and in particular, it has almost no impact on the cash flow of vulnerable businesses. So the interest rate adjustment is all good and well. It might in ordinary times give you some type of relief and stimulus. These aren't ordinary times, and unordinary policy is needed.
If the government doesn't come up with a sustainable economic stimulus package, then the economy in this country is doomed to failure, and it's going to take years to recover. I'm Angelo Coppola for CGTN in Johannesburg, South Africa.
Now, most African countries have suspended flights, closed schools, and banned large gatherings to contain the COVID-19 pandemic. Things have not been easy in many of them, as most people depend on day-to-day jobs in the informal sector for their livelihood. Rwanda has seen a spike in infections, and it is among those countries that have implemented drastic measures. CGTN's Alexandria Majala takes up the story.
COVID-19 infections in Africa are rising fast, and hospitals are ill-equipped to cope. Governments are taking unprecedented measures to contain the spread of the novel virus. In East Africa, Rwanda went into total lockdown after reporting 17 confirmed cases, the highest number in the region. The nation banned all unnecessary movements, excusing trips for healthcare, food, or banking. So far, public gatherings have been banned, schools, churches, mosques, and bars have been shut down, and airports closed. The landlocked nation is also closing its borders completely, except for goods, cargo, and returning citizens. Anyone arriving in Rwanda will be subject to a 14-day quarantine at designated locations. However, some businesses considered essential have remained open.
My shop is going to stay open because I'm dealing with things that are going in with sanitary that can help people in their lives. Even that we can prevent since this virus has come to our country. So I think that's why our shops are going to be open.
While most streets remain deserted, some trading centers saw a rush as Rwandans stockpiled food, anticipating a long wait indoors.
What I can say for me, my shop is open, and my colleague, she is not open. So whereby she can be affected, I think we can help each other.
A 2016 analysis by the RAND Corporation, a U.S. think tank, found that of the 25 countries in the world that were most vulnerable to infectious outbreaks, 22 were in Africa. The others were Afghanistan, Yemen, and Haiti. After lagging behind the global curve for coronavirus infections and deaths, Africa has seen a sudden rise in cases over recent days. Eritrea, Uganda, Angola have joined the growing list of African nations to confirm their first cases, while Tanzania, Ethiopia, Kenya, and Mauritius have announced more cases. The continent has now reported more than 1,100 infections, with more than 1,000 of them in sub-Saharan Africa. Meanwhile, the World Health Organization expresses concern that poor sanitation, urban crowding, the lack of intensive care units, equipment, and trained staff could hamper any response in most of the continent. Alexandria Majala for CGTN.
Meanwhile, authorities in Uganda are encouraging people to stay home as part of a range of efforts to contain the COVID-19 pandemic. So far, the East African country has confirmed at least 9 cases of people infected with the virus. But many fear that number will rise as local businesses scramble to adopt contactless delivery systems. CGTN's Hilary Ayesiga filed this report from Kampala.
Henry Liwega is a courier at an online marketplace, Jumia, Uganda. He's been instructed to keep a 1-meter distance from all customers.
You can put the item on the doorstep, then the customer comes, verifies the item. After verifying, he or she puts the money at the doorstep, and you are supposed to come, pick the money from the doorstep, then you step back and the customer steps back.
Using this method, employers hope to keep their staff and customers safe.
We want to minimize the risk of contact, minimize the risk of transmission between us and the customer and vice versa. And so we encourage customers to pay cashless, and we're able to take an item, deliver to your premise without touching you in a safe and in a safe manner.
Uganda is currently on a partial lockdown because of coronavirus, and for those who want to buy products while at home, this online shop is increasingly becoming an option. The company has also taken other measures to contain the virus, such as regular temperature checks. The Uganda government has issued guidelines on how to stay safe. They include anyone with a flu-like symptom is required to seek treatment, wear a mask, and stay at home. It's hoped that if these measures are complied with, many Ugandans could be saved from contracting the disease. Hilary Isga, CGTN, Kampala, Uganda.
Elsewhere, Tunisia has started negotiations with the International Monetary Fund on a new loan program. The North African economy signed a deal with the IMF in December 2016 for a $2.8 billion loan designed to give authorities breathing room to implement much-needed economic reforms. The fund disbursed a $247 million installment from that deal in June last year. Since then, however, negotiations on a sixth installment have stalled due to a political crisis following last year's election, as well as the ongoing COVID-19 pandemic, which has decimated Tunisia's tourism sector. Now, 73% of Tanzania's villages are connected to its national grid. The East African country is home to about 57 million people, but despite having over 57 trillion cubic feet of natural gas reserves, Tanzania is still plagued by power shortages. CGTN's Daniel Kijo has the details.
It's a plan that's paying off, bringing electricity to every village, suburban town and city in Tanzania. The effort involves reducing connection costs from $135 to $12, fixing and connecting electric poles to customers, and extending the national grid.
This has made us the first in Africa when it comes to rural electrification. We are followed by Nigeria and other countries like South Africa.
The Rural Electrification Agency has been connecting village customers at $12 per household, but the minister said residents in the municipalities will also get more discounted rates similar to the village rate. After its success in village zones, it has now launched a 9-month pilot project to connect all suburbs in Dar es Salaam, a strategy expected to be completed in July this year, a plan he says will be rolled out nationwide.
We now call on to owners of such institutions to show support by doing wiring in their establishments so that when electricity gets to their area, we would be able to connect them easily.
The government says it has identified 214 suburbs to benefit from the plan. It intends to spend about $32.3 billion to bring electricity to citizens living in the selected zones. Daniel Kijo, CGTN, Dar es Salaam.
And here's what's coming up in the sport. The World Under-20 Athletics Championships set for Nairobi from the 7th to the 12th of July moved to a later date.
How would you create your legend? On the fields, on the tracks, in the arenas of Africa. Were you born to be a player? Could this moment be yours? Sports Scene. Find your game.
Africa Live. Find your voice.
We begin with athletics news, where the athletics governing body, the World Athletics, announced the postponement of this year's Under-20 World Athletics Championships as major sports events continued to tumble under the weight of the coronavirus pandemic. The decision, announced late Tuesday evening, came only a few hours after International Olympic Committee postponed the 2020 Summer Games in Tokyo until next year. Kenya was awarded hosting rights for the championship in July 2018 after hosting a successful World Under-18 Championship in Nairobi a year earlier, attracting record crowds and creating an exciting atmosphere for the young athletes there. Now, the Tokyo 2020